Assalamu alaikum. Welcome back. You are listening to the Maureen Mukwanda Show on Assalam Media. So it is time for our Women's Health Tuesdays, and today we are going to be discussing headaches and migraines. If you have been experiencing headaches and migraines, I don't know. I can't say that it's something that's in the air because it is one of the symptoms of the coronavirus. Maybe you should get yourself tested just to be on the safe side. But yeah, it also could be an underlying factor. So let's find out more with Dr. Ngobile, who is on the line right now. Hello, Dr. Ngobile.
Good day, Mariam and the listeners.
How are you today, Doctor? Thank you for joining me.
I'm well and yourself, thank you.
I'm good, thanks. All right, so start off by telling us what is the difference between a headache and a migraine?
Importantly, migraine is a type of headache. So it's recurrent headaches which are patterned. They may be followed by a warning symptom. Generally, other people may feel like blurred vision just before the headache, or sometimes they can have a particular smell, or they may have some slight dizziness, just something that is actually a sign in their body that they are about to get those headaches.
Wow. How do you know if you have just a headache or a migraine headache?
Importantly, migraine headaches are kind of chronic headaches. So, the diagnosis of the medical doctor is usually a conclusion for somebody who suffers with migraine headaches. But as we know, headaches can actually just be a symptom that is very varied, caused by various problems in the body. Things like lack of sleep, even hormonal changes, especially in women, pregnancy. It could even be side effects of medication, certain foods. Also, if you have any underlying fever or any underlying medical issues can actually cause headaches. In women, things like anemia, where there is, lack of hemoglobin. So it's a very non-specific symptom.
Okay, so when should you be concerned about a headache?
Importantly, any headache that is of sudden onset, which is new. If you don't usually suffer with headaches and suddenly you are getting, this throbbing headache, then it's just one symptom. And if headache is accompanied by weakness, dizziness, any loss of balance or falling, any numbness or tingling, or if, your body feels weak and you can't move a certain part of the body. And obviously, if as family members we observe that a person has complaints of headache and suddenly they are confused, or there is a change in their speech or in their personality and behavior, or sometimes any headache that's accompanied by seizures. So all those are things that, when accompanying a headache, should actually trigger one to seek immediate medical attention.
All right. What can one take to prevent these types of headaches?
So importantly, things like we've mentioned, adequate sleep, hydration, just your general health, is actually something that's very important to avoid headaches. Just take supplements, especially if you're working hard. Even at this time, I would advise that everybody is on supplement, especially for women, be on iron supplements, as a preventative measure, just to keep yourself healthy.
Now, what about this issue of cell phone screens, TV screens, computer screens? Can that also contribute to frequent headaches?
Definitely, that is actually one of the contributor to headaches because of the light exposure that is with all these technological gadgets. It can actually strain, your muscles around the forehead, which actually helps your eyes to focus. So, in fact, among the top list of causes of headaches, where people find that they are on multiple medication can be related to their eyes. So if they have some problem even with the glasses that they use, um, so before you even go to have a CT scan when you have a headache, you should actually see somebody to check on your eyes or have your glasses, just recheck.
Mm-hmm. And my mom told me that she was experiencing headaches, and I told her, okay, maybe it's your glasses. And she tried not using her glasses for a bit, and well, the headaches have eased and are much better now. So it's done with those glasses. The mistake that she made is that she was using her older glasses when she has a new set. So she's supposed to have been using her new ones instead of the old ones.
Yes, definitely. That can actually bring a lot of strain in the eye muscles, and unfortunately, the eye muscles are on our forehead. So anyone presenting with frontal headache or around the eye area, it's actually just a warning to say that there could be something wrong with the eyes.
Oh, yes. Now that you mentioned it before, I forget. Please describe to us the types of headaches. I know that there's a frontal headache, which are caused by, eye strain muscles, and then you get the back headaches and the side headache, the middle headaches. Well, what are the differences between those headaches?
Importantly for us, in terms of classifying headaches, is to try and figure out what the cause of the headache. So one
Mm-hmm.
can get tension headaches, which are headaches that are around the head. So like a
Mm-hmm.
tension band around the head. And they can get what we refer to as cluster headaches. And you also get migraine headaches, as we have mentioned, which is actually a headache that can be very severe and that can be disabling. And it may be accompanied by things like vomiting, and people may have, in fact, visual problems as a result of the headache. So you can imagine if you were to work with a computer and you are having your migraine attacks at the time. So that is the type of headache which is extremely severe.
Mm-hmm. All right. Well, I had a migraine headache on Sunday and I felt like throwing up, but I didn't throw up. Instead, I just decided to sleep it off, but it was better on Monday. So I don't have the migraine headache anymore, and I decided to use glasses for the blue light. And I guess it has been working out. Drinking more water as well, and just making sure that I get some rest and not having a device before bed. Those have actually helped.
Yes, and importantly, like you say, as part of treatment of headaches, obviously, our bodies, too much of everything is not good for you. So this includes
Mm,
exposure to technological devices. So you need to take a break, like just take a tech break. I call it a tech break, away from all the computer screens, your phone, and everything. Just when you take a walk, just leave your cell phone at home, and it's also good for you. You get time to think as well,
mm,
because before you know it, when you jog and you're taking time off to unwind, your cell phone rings or you get a message, and your attention is actually just drawn, and your brain is working non-stop. So relaxation is actually just part of what you get when you get away from the technology.
mm. All right, sir. Thank you once again, Dr. Mobile, for the advice. I hope that our listeners, whoever has been experiencing headaches, um, first of all, try and cut down on too much cell phone uses and other technological devices. And from there, if nothing works out, if everything that you've tried doesn't work out, go and get checked out. Thank you, Dr. Mobile.
Okay, my pleasure. Thank you so much. Bye.
All right. Okay, that was Dr. Nobile Sitole on the line. You can find her on social media. She is on Facebook as Dr. Nobile. If you'd like some more information about headaches, okay, first of all, read up on it. The world is your oyster, and so is the internet. Read up on it, find out some more information about the types of headaches that you've been experiencing. Um, don't go and see a specialist just yet. You might be just wasting a lot of money if you do go and see a specialist. But to try and limit your tech use, drink some more water, get some more rest, less using your device before bed. That does go a long way in helping you get some proper quality rest, not property, but proper quality rest. And exercise, get some fresh air, vitamin D, do all of those things. And if it doesn't help out, then you can go and get yourself checked out first at your GP, and your GP would be able to recommend whether you see a specialist or not, because it could also be an underlying problem, like you could be on the road to getting a stroke or meningitis or something else. But make sure that you are on the safe side by getting yourself checked out. Please leave your comments, questions, queries, or suggestions in the comment section below on our Facebook. You can also send them to us on WhatsApp. The number is 0617660355. To stay with us, we will be right back.
You are listening to Mariam Makwanda live